The other factors or the other problems with obesity and metabolic syndrome is obesity, hypertension. We need to know more about hypertension, what's the mechanism of this, how it's developing with obesity, how we can act, how we can treat this problems. So epidemiology studies have shown a correlation between body weight and blood pressure. Around 70% of hypertension in men and around 60% in women are associated with obesity. Here we see a correlation between hypertension and body mass index. We see that any patient who has high body mass index, he will have a high percentage of hypertension. So I think we mentioned this before. Insulin resistance is increasing. Hyperinsulinemia is the result of insulin resistance. This will lead to activation of sympathetic nervous system, leads to vasoconstriction, increased cardiac output, and increased sodium and chloride reabsorption, which lead to end result, which is blood pressure is increasing. The mechanism of that is actually increased renal medullary compression, increased renin-angiotensin system activity. This will lead to increased sympathetic nervous system activity, and it will lead to tubular damage, which increasing the sodium chloride reabsorption. This will lead to increased arterial hypertension, which is giving us the end result, which is increasing blood pressure. Obesity and cardiovascular risk, as we said before, visceral obesity could give you sodium retention, increased heart rate, endothelial dysfunction, diabetes, and this will lead to increased cardiac output, which is giving you high blood pressure and congestive heart failure as end result if not treated.